campaigner from Hammersmith. I wanted to congratulate Ealing for the brilliant meeting here, but I also wanted to say that I wanted to talk about how I think we should win, because I don't just want...
Mic is on.
Is it on? Off?
It was.
Thank you. I don't just want a good campaign, I actually want to stop the A&E's closing. And what do we need for that? Partly what we need is more of what we're doing, which is a big, big popular campaign. And I think it has been a bit of a snowball that's growing and growing. And I kind of want to say we all need to do something. You don't have to be like there for years and standing in the snow and rain. If you do a little bit, that's also fine. Do you know what I mean? We don't need people to be martyrs about it. But there are lots of things we can do. The focuses for our campaign at the moment are the local election. We're doing a lot of door-to-door leafleting. And when the Imperial NHS Trust business case comes out, that's when we want to be tackling that as well. And I think it's really important that across West London we pool information. So, for example, Imperial's board meeting last night had a lot of stuff about maternity and vacancy rates and so on that we could all usefully use. So that's one thing. But what are the bits we're missing? And Arthur talked about health workers and where are they? And I think you really have to understand the context. Health workers are, if they're still working, they're doing at least 2 people's jobs now. They're possibly doing 3. They're absolutely intimidated. They're scared about disciplinaries. They're scared about redundancy. This is not exaggeration. This is go to any clinic and you'll see it. And I therefore don't think it's surprising that, for example, on our website, on our email list, we have lots and lots and lots of health workers who support us, but actually relatively few who have the confidence to come out and speak. And, you know, fair play to the ones who do. And actually that's why I think the Ealing strike's so important, because that is the worst off, the people on £6.31 with no sick pay at all, who are fighting back. And do you know, when we were raising that in the campaign, actually for me, it wasn't one of the easiest arguments. I did 2 collections, one from campaigners and one from my own union branch. And actually, it wasn't the easiest thing in the world to get money from people. People don't necessarily automatically make the links. People think, oh, what have they got to do with us? What's this got to do with the hospital? And I think it's really, really important that we all say, look, if we want an NHS where patients are respected, you have to respect staff, and you can start by paying more than £6.31 an hour. So that's a kind of thing that actually support for the Ealing Hospital strikers or any others should be mainstream within the campaigns the next time it happens, and I'm sure it'll be happening soon. And the final thing I wanted to say is, as well as involving more health workers, as well as the mass public campaigning, the other thing we have to do is coordinate, not just across West London, though that's a good start, but actually across London. And I'm just going to put on a plug that tomorrow night, if you haven't heard enough from Louise and John tonight, they're both speaking tomorrow in Camden Town Hall at a London Keep Our NHS Public Coordinating Group. And actually it'd be good to see a few people there, purely because it's really, really, they are the opposition. Our enemy are trying to be coordinated and strategic, and we have to be exactly the same. Thank you.
Hear, hear. Hear, hear.